I'm really excited. Glad that your wound healing up. Do you have a wound that needs dressing? Today I'll show you how to properly clean and dress a wound at home to prevent infection and to speed up the healing process. In today's demonstration, we'll go through the step-by-step process of proper wound dressing. Here's our wound, and our patient today graciously allowed us to video record him. He's a returning patient, and I will show you the initial presentation of his wounds. He had the bigger ulcer on the left side and the smaller on the right side. For now, we will deal with the one on the left side. The technique we demonstrate today is ideal for both home care and in the clinical setting. We'll prepare and clean the area. We already cleaned the bed in preparation for his wound inspection. We already washed our hands, and that's in a previous video. We have placed an incontinent pad under the limb to reduce uncontrolled spillage of fluids we use, as well as body fluids like bloody exudates, purulent, serous exudates. Purulent meaning pus, and serous meaning a clear fluid. Simply defined, an exudate is a medical term for the type of fluid coming out of the wound. I have already double gloved, as you know I like to do in one of the previous videos. We have all our supplies ready: gloves, saline, gauze, and a fresh compression dressing specific to our patient today. We previously removed the old dressing. If on removal of the dressing, the gauze is stuck to the wound, then you can easily moisten that dressing with some saline to avoid damage to the healing tissue. It's important to keep observing your patient's response as you perform the task at hand. Do your best not to cause them any pain. They will remember how considerate you are to them, and even if they do have some pain, it will be forgivable. I have started cleaning this wound, taking note of any exudates. There are no exudates on the wound, but the wound is moist. I have started on the inside of the wound, gently spiraling outwards so that I move bacteria, debris, any unwanted material out from the bed of the wound. The bed of the wound is described as the actual red surface of the ulcer. That way, we avoid contamination by moving from central of the wound, spiraling outwards. We do it again, not only on one pass, but as many passes as is necessary. As you can see on the edge of this wound, there are some yellow crusty remnants. Those are from exudates, plasma that has become dried out, much like how honey becomes crystallized when left open on the counter. And as you continue to observe, there's removal very easily of that crusty material. It is easily peeling away. Our patient did a very good job of managing dressing his wound at home. We use sterile saline and gauze to clean from the inside out. Every wound is different. Some wounds require one pass, other wounds require much more than one. Under these crusts, bacteria love to reside, and so sometimes if you don't clean it adequately, even after taking antibiotics, reinfection rates are high because the bacteria have not all been eliminated. There are times when you can't remove all of the exudates or all of the crusts, so you will have to allow for some time, a few days of dressing changes to remove the crusty material. So I won't force the point any longer with our patient. He has already been so gracious to us. Okay, I'm going to wipe one more time. I'm going to wipe more generally, more widespread. Excellent. I will deglove. For this wound, I really only need 1 square of gauze. All wounds, most wounds, need moist dressing. This is the primary dressing. It is the dressing that comes into direct contact with the wound bed. I have approximately 4 swabs of dry gauze, and so the dressing that we are doing today is a wet to dry dressing. Never use alcohol or peroxide. These are stringent and are harmful to healthy tissues. Soft candle or bushes, don't use, as they will slow down healing. For this wound, we do not recommend any other agent except normal saline. Our goal in cleaning the wound is to prepare the wound bed for adequate skin coverage. If you're doing this dressing by yourself, you can open 1 gauze that will help to keep that dressing in place. We will secure the dressing by using a compression bandage, because this is what is necessary for this specific patient. In another video, I will demonstrate the purpose of compression dressings. But for now, this is adequate for covering the wound that he has. This dressing is to be changed every 24 hours or once a day. Watch for signs of infection, such as redness, increased redness around the wound every time the dressing is changed, swelling, excessive swelling, extra tenderness, or any exudates such as pus. If you're unsure about your wound, you're welcome to make contact with us. Like and save this video for future reference. If you or someone you know needs professional wound care, book an appointment with us today. This demonstration follows best wound care practice to minimize infection risk and promote faster healing.